look on the introduction about infertility. Basically, infertility is a disease of the male or female reproductive system. Infertility is failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. It can be classified as primary or secondary infertility. Primary infertility is when a pregnancy has never been achieved by a person, while secondary infertility is when at least one prior pregnancy has been achieved. The graph shows total fertility rate in Malaysia from 2012 to 2022. As we compared from 2012 until 2022, the data showed decrease in total 0.6, showing that people in Malaysia are having issue. In 2020, a study was conducted by UiTM researchers and a total of 170 respondents met eligibility criteria agreed to participate in the study. And as you can see, duration of infertility 1 to 3 years have the highest percentage compared to other years. And this shows that people in Malaysia are struggling to conceive babies. Now that we have been briefed about infertility, let us study more about the factors and some solutions to solve this issue in Malaysia.
4 key factors contributing to female infertility are alcohol consumption, smoking, polycystic ovary syndrome, PCOS, and endometriosis. Drinking between 1 and 5 alcoholic drinks per week can reduce your fertility. Alcohol consumption can disrupt the delicate balance of hormones in the body, including estrogen, a key reproductive hormone in women. Chronic alcohol consumption has been linked to a decrease in the number of viable eggs remaining in a woman's ovaries, known as the ovarian reserve. Regular alcohol intake can disrupt the process of ovulation, where the ovary release a mature egg for fertilization. Drinking alcohol can increase the chance of developing uterine fibroids. When you drink alcohol, it changes the levels of different substances in your body, like hormones and growth factors. This change can make it more likely for uterine fibroids to form. Chemicals such as nicotine, cyanide, and carbon monoxide in cigarette smoke speed up the loss rate of eggs. Unfortunately, once eggs die off, they cannot regenerate or be replaced. This means that menopause occurs 1 to 4 years earlier in women who smoke compared with non-smokers. Smoking can also increase risk of ectopic pregnancy. This type of pregnancy occurs when the fertilized egg implants somewhere outside the uterus, most commonly in one of the fallopian tubes. As a result, the fertilized eggs cannot survive and the pregnancy cannot continue. Endometriosis is a disease in which tissue similar to the lining of the uterus grows outside the uterus. It can cause severe pain in the pelvis and make it harder to get pregnant. Endometriosis can start at a person's first menstrual period and last until menopause. With endometriosis, tissue similar to the lining of the uterus grows outside the uterus. This leads to inflammation and scar tissue forming in the pelvic region and rarely elsewhere in the body. PCOS or polycystic ovary syndrome affects up to 1 in 10 women. Women naturally produce small amounts of the sex hormone testosterone, but in PCOS, your body may be making too much. This may be because your cells are resistant to insulin. This hormone helps your body to control the level of sugar in your blood. If your cells are resistant to insulin, your body makes more than it should. The extra insulin causes your ovaries to make too much testosterone. All these hormone changes can stop your ovaries from releasing an egg each month.
What is in vitro fertilization? IVF. IVF is a type of assisted reproductive technology where sperm and egg are fertilized outside of the human body. It is a complex process that involves retrieving eggs from ovaries and manually combining them with sperm in a lab for fertilization. After several days, the embryo is placed in the uterus. Pregnancy occurs when this embryo implants itself into the uterine wall. It is proved when 8 million babies have been born from IVF since 1978.
Next, we move to IVF process, which is have 6 process. First, patients will undergo taking of birth control pills or estrogen, followed by ovarian stimulation, then egg retrieval, and then sperm collection, fifth, fertilization, and the last step, which is embryo transfer. First step, birth control pills or estrogen. This step, patients will taking birth control pills or estrogen before IVF treatment. Patient will prescribe to take estrogen and progesterone or only estrogen. This is to stop the development of ovarian cysts and control the timing of patient's menstrual cycle. This step can help to maximize the number of mature eggs during the egg retrieval procedure. Next, patient will undergo ovarian stimulation process to produce follicles that contain number of mature eggs in the ovaries. Patient will receive daily hormone injection within 8 to 14 days. And then, the healthcare provider will measure the size and the growing ovarian follicles, as the size of each follicle indicates the maturity of egg. Once the maturity of egg reach, the patient will receive trigger shot within 36 hours before egg retrieval to finalize the maturation of eggs.
After 36 hours receiving the trigger shot, the process will continue with egg retrieval. The healthcare uses an ultrasound to get a thin needle into each of patient's ovaries through patient's vagina. The needle is connected to a suction device used to pull patient's eggs out of each follicle. Patient's eggs are placed in a dish containing a special solution. The dish is then put in an incubator to control environment. The man is asked to abstain from sex for 2 to 5 days prior to the collection of sperm. And this sperm collection is usually achieved through masturbation. Note that this is to avoid any bacteria that can affect the quality of sperm. Stress can sometimes inhibit the man's ability to produce a specimen when needed.
Next, patient will undergo the important parts of IVF, which is fertilization process. The embryologist will try to fertilize all mature eggs using intracytoplasmic sperm injection, ICSI. The immature eggs cannot have ICSI performed on them, but the immature eggs will be placed in a dish with sperm and nutrients. The immature eggs rarely finish their maturation process in the dish. If any immature eggs does mature, the sperm in the dish can then attempt to fertilize the egg. On average, 70% of mature eggs will fertilize. For example, if 10 mature eggs are retrieved, about 7 will fertilize. If successful, the fertilized egg will become an embryo. After the process of fertilization is successful, the fertilized egg will become an embryo and undergo embryo transfer process. Over the next 5 to 6 days, the development of embryos will be carefully monitored. 50% of fertilized embryo progress to the blastocyst stage. This is the stage most suitable for transfer to patient's uterus. These are 2 types of embryo transfer. First, fresh embryo transfer. Embryo is inserted into patient uterus between 3 and 7 days after the egg retrieval procedure. This embryo hasn't been frozen and is fresh. Second, frozen embryo transfer. Frozen embryos inserted into patient uterus. This method is more likely to result in a live birth. Frozen embryo transfer can occur years after egg retrieval and fertilization. We have reached to the final step of IVF process, which is the step that determines whether the result of IVF is negative or positive. The final step is pregnancy. Pregnancy occurs when the embryo implants itself into the lining of your uterus. Your healthcare provider will use a blood test to determine if you are pregnant approximately 9 to 14 days after the embryo transfer. Wait, why do you think IVF is the best treatment for infertility? These are 4 reasons why IVF is the best treatment for infertility. First, get pregnant quicker, because statistically, women who start with IVF get pregnant faster than those who begin with IUI then switch to IVF. Second, IVF can reduce risk of multiples. IVF with a single embryo transfer almost guarantees a single-term pregnancy. If IUI is used with medications, there is a significant risk of multiples. Next, IVF can help for future family planning. Why? Because women can freeze their unused embryos for later use. This enables them to have them ready to go to when they wish to expand their families and has the added advantage of keeping younger eggs viable. For the last reason why IVF can help for infertility cases is IVF can reduce miscarriage risk. Because genetic testing is the only way to reduce miscarriage risk. This can only be done with IVF. This graph has shown why IVF is the best treatment to reduce the number of cases in infertility. Because according to this graph, it shows that when patients undergo straight to IVF process, it has higher risk than IUI, with the possibility of leading 15 to 20% of ideal candidates.
Don't smoke or quit smoking. For women, it may cause hormonal imbalances which alter hormone levels, including estrogen and progesterone, which are crucial for ovulation and maintaining a healthy menstrual cycle. Smoking also causes damage to ovaries, where chemicals in cigarettes, such as nicotine and carbon monoxide, can damage ovarian follicles, reducing the number of viable eggs and accelerating the loss of eggs. In men, smoking reduces sperm quality, which is in sperm count, motility, and morphology. This can significantly reduce the chances of sperm successfully fertilizing an egg. First, reduced alcohol may increase fertility. Alcohol leads to increased risk of of miscarriage for alcohol consumption, especially in the early stages of pregnancy. Besides, alcohol can interfere with the absorption of folic acid, which is a vital nutrient for fertility and the development of a healthy fetus. Furthermore, regular exercise is one of the ways to increase fertility because regular physical activity supports better metabolic health, reducing the risk of conditions like diabetes and metabolic syndrome, which can affect fertility. Exercise can enhance insulin sensitivity and reduce insulin resistance, which is particularly beneficial for women with polycystic ovary syndrome because a common cause of infertility. Exercise releases endorphins, stimulates a healthy libido, and supports detoxification. Eating foods rich in antioxidants can positively impact fertility by improving overall reproductive health. Antioxidant is a good nutrition, supports overall health, which in turn supports reproductive health. A well-functioning body is better equipped to handle the demands of conception and pregnancy. Adding more fruits, vegetables, nuts, and whole grains to diet. Foods that tend to be higher in antioxidants is like vitamin C and E. Besides, stay hydrated is also crucial to increase fertility. Drinking plenty of water and avoiding sodas and sugary beverages may further boost your chances of conceiving. Lastly, manage stress level. Mental and psychological health are more closely linked to reproductive health. The added stress of trying to conceive can cause hormonal shifts. Cortisol, the stress hormone, proceeds to disrupt communication between your brain and ovaries, which causes irregular cycles. In women, stress can lead to disruptions in the secretion of GnRH, which controls the release of LH and FSH. These hormones are crucial for ovulation and maintaining a regular menstrual cycle. In men, stress can lower testosterone levels and affect the production of sperm by disrupting the release of gonadotropins.
Bismillahirrahmanirrahim. Lillahi mulku samawati wal ard. Yakhluqu ma yasha. Yahabu liman yasha'u inatha wa yahabu liman yasha'u dhukur. Aw yuzawwijuhum dhukrana wa inatha. وَيَجْعَلُ مَنْ يَشَاءُ عَقِيمًا إِنَّهُ عَلِيمٌ قَدِيرٌ.
In the Quran, God comforts those who face fertility difficulties in Surah Ash-Shura verse 49 and 50. Most modern reproductive technologies have only recently been made available. The Quran and Hadith do not directly comment on any specific procedure, but scholars have interpreted the guidelines of these sources to develop their opinions.
So, moving on to opinion of Islamic scholars. Most Islamic scholars are of the opinion that IVF is available in instances where a Muslim couple is unable to conceive in any other way. Scholars agree that there is nothing in Islamic law which forbids many types of fertility treatment as long as it does not go outside the bounds of the marriage relationship. If IVF is chosen, the fertilization must be done with sperm from the husband and an egg from his wife, and the embryos must be transplanted into the wife's uterus. However, some authorities stipulate other conditions because masturbation is not allowed in Islam, and it is recommended that the collection of a husband's semen be done in the context of intimacy with his wife, but without penetration. Further, because freezing off a wife's egg is not allowed, and it is recommended that the fertilization and implantation occur as quickly as possible.
In conclusion, infertility is a complex challenge in Malaysia due to unhealthy lifestyle, health condition and environmental factors. Fertility treatments such as IVF and IUI are available. Accessibility and affordability remain barriers for many. To overcome the infertility issue, addressing infertility requires a multifaceted approach that encompasses improving access to healthcare services, raising awareness, destigmatizing infertility, promoting healthy lifestyle and providing psychosocial support.